you guys to wake up for the best part. Well, I know most of them have already. We've already been through. We've already been through 2 types of cardiomyopathy, and most of this is going to sound like reiteration, and for that I apologize beforehand. So we have restrictive cardiomyopathy now. Before we get into that, we already know that cardiomyopathy affects the heart. So I want to talk a little bit about the heart. The heart is a specialized muscle that contracts regularly and continuously, pumping blood to the body and the lungs. So think of the heart to your body as an engine is to a car. Blood flows into the superior vena cava and the inferior vena cava into your right atrium. It then travels down through the tricuspid valve into your right ventricle. From your right ventricle, it takes deoxygenated blood. This is the exception. Make sure you guys remember this. Arteries always carry oxygenated blood, but the pulmonary artery actually carries deoxygenated blood into your lungs, and the alveoli then form gas exchange and brings oxygenated blood back into your left atrium. The left atrium, then the blood flows down in through your mitral or bicuspid valve into your left ventricle, and then your left ventricle takes it into the aorta and spreads the blood out through your body. So that's that little quick crash course on the heart. Let's do electricity. Remember, we know that the SA node, or the sinus node, right here, it sends electricity down to your left atrium and your right atrium, and also to the AV node, atrioventricular node. Then the atrioventricular node travels down what we know as the bundle of His, right here, and then branches off into your left, your right, and your left. And I know we all know how big of a problem heart disease is, and this just puts in perspective that up to 95 in every 100 sudden cardiac deaths are due to disease that causes abnormality of structure of the heart. So 95%, that's a pretty big number. What is restrictive cardiomyopathy? Well, here's a picture right here. A normal heart, that's right, it's like on the left, right? It's not necessarily thickened like hypertrophic is, but it's stiff and rigid. So the ventricle's ability to fill with blood is inhibited. And that's basically what restrictive cardiomyopathy is. The basis of it is the ventricles are stiff, rigid, and that inhibits the heart's ability to pump with blood. It is the rarest form of cardiomyopathy. That's probably why most of you have never heard of it. And it's also the most dangerous because only 30% of patients survive more than 5 years after diagnosis. It tends to affect mostly older adults as well. Okay. The pumping or systolic function of the ventricles may be normal, but the diastolic, or the ability of the heart to fill with blood, is abnormal in restrictive cardiomyopathy. And it's also harder for ventricles to fill with blood, and over time, like anything, if the heart isn't pumping blood properly, it's going to lead to heart failure. So it's usually normal size during when you have restrictive cardiomyopathy. Your heart overall is normal. However, your atriums are going to be slightly enlarged due to the fact that your ventricles are not doing their function properly. So your atriums are working harder, and that enlarges them. So you have abnormal tissue or scar tissue that replaces the normal heart muscle, and this is the cause of the ventricles being stiff and rigid. And the abnormal heart function obviously affects many organs, your livers, your lungs, your kidneys, and there's a whole list. So before we start this video, I want to talk to you guys. He's going to say something about the apex, and the apex is your lowest and most superficial point of your heart. It's right underneath your left ventricle, right here. So when he says apex, don't try to get confused. That's what he's talking about. So you can go ahead and play the video.
This is a patient with endomyocardial fibrosis, and I will now show you the typical features that we can find in such patients. In the peristernal long axis view, we can appreciate that there is fibrosis of the subvalvular apparatus, which extends here into the papillary muscle, and also into the posterior mitral valve leaflet. You can see that the posterior leaflet is restricted in its motion. and we can expect at least some degree of mitral regurgitation in this patient. But the real interesting, real typical findings for endomyocardial fibrosis are usually seen in the apical views. Let's take a look at the apex. You see the image quality is not very good, which is easily explained because we have fibrosis and also an infiltrate here in the apex, so that we don't get very good image quality down here, but we can nicely see that there actually is an infiltrate here in the apex, very equilucent structures which fill the apex and which are very unlikely to be a thrombus simply because we have a normal contraction pattern here in the apex.
I thought that video was cool because you got to see like an ultrasound and you can see the valves opening and closing, so that's why I showed that video. Alright, here we go. Causes of restrictive cardiomyopathy. They can affect either ventricle or it can affect both of them. And they're usually, since it's so rare, there's not a variety of ways it can affect you. It can be associated with a different heart disease of the heart muscle, so it doesn't necessarily have to be your primary disease. It can be a secondary disease. And the most common causes of restrictive cardiomyopathy are amyloidosis and the scarring of the heart muscle, of the heart. And it's usually unknown, but this is a pretty good guess here. Post-heart transplant, it occurs usually post-heart transplant, so I would think that that has something to do with it, but obviously since nothing has been proven, we can't say that for sure. And amyloidosis is just referring to a variety of conditions where amyloid proteins are abnormally injected or deposited into your organs and tissues, and they cause harm to those specific organs or tissues. Some more causes are chemotherapy or radiation exposure to your chest, carcinoid heart disease, which I actually have a picture of right here. This is your endocardium. So you can see like it's right here next to your tricuspid valve in your right ventricle. And basically what carcinoid heart disease is that there is plaque-like thickenings all in here that block this. So that's the causes of carcinoid heart disease, which is a precursor to restrictive cardiomyopathy. Other diseases of the endocardium, which I showed you, are endomyocardial fibrosis and Loeffler syndrome. Loeffler syndrome is pretty rare. It's basically just a swelling or inflammation of the lungs from an increase in eosinophils, is how you say it, and it's a type of white blood cell. And endomyocardial fibrosis is just the scarring of the endocardium. There's a list of other causes: hemochromatosis, radiation fibrosis, tumors in your heart, sarcoidosis. And I'm not going to go into depth with all these. Hemochromatosis is just too much iron in your blood, also known as iron overload. Radiation fibrosis is a scarring of your lungs from radiation. Sarcoidosis, there's no known cause for it, but at least inflammation that affects your body organs. Tumors in your heart, that's